Hello everyone. In this session, we are going to discuss a very important topic, that is vasculitis. Now, in your university exam, you usually get a long question on that. So if you're asked a long question about vasculitis, you are supposed to write about all important type of vasculitis. But sometime in your university exam, you get a short question on any one type of particular vasculitis, either on temporal arthritis or Takayasu arthritis or polyarthritis nodosa, that is PAN, Kawasaki disease, Berger disease, microscopic polyangiitis, Churg-Strauss, Regner. So we are going to discuss 8 important type of vasculitis in this session. So without wasting any further time, let's start the topic. Vasculitis. So here you can see we are starting the topic vasculitis. So first of all, I will let you know the definition of vasculitis. What do you mean by vasculitis? Then we will see the classification. We will see 2 type of classification. The first classification is based on the type of the size of the blood vessel. So blood vessel is small, medium or large. So small vessel vasculitis, medium vessel vasculitis or large vessel vasculitis. That is based on the size of the blood vessel. And the second classification is based on the type of inflammation, whether the inflammation is granulomatous or necrotizing. So based on that, the second classification is that. Now coming on the important features of important type of vasculitis. So we will be discussing 8 important vasculitis in a comparative tabulated manner. So the 8 important ones are, in a sequence I will discuss. First I will discuss the temporal and Takayasu, that is large vessel vasculitis. Then I will discuss PAN, Kawasaki and Berger, that is medium vessel vasculitis. These are large, these are medium. And finally we will discuss 3 small vessel vasculitis, that is microscopic polyangiitis, Churg-Strauss and Regner granulomatosis. So for each of them, first I will let you know the introduction, then the arteries involved, then the morphology and then the symptoms. So let's start the topic vasculitis, and I assume that all the dear students will make this comparative table with me. This table is already provided in the book. If you have the hard copy of the book, you start filling this table while watching this session. So let's start the vasculitis. What is vasculitis? First, let me tell you the definition of vasculitis. What do you mean by vasculitis? Vasculitis. So basically itis in pathology means inflammation. So vasculitis is the inflammation of the wall of the blood vessel. So in the wall of the blood vessel, there are 3 layers. You can see these are the 3 layers present in the wall of the blood vessel. The innermost is the intima. You can see this one is the intima. The middle one is the media. The thickest one is the media. The middle one is the media. The thickest one, the middle one is the media. And the outermost one is the adventitia. The outermost one is the adventitia. Okay, so inflammation is of the wall of the blood vessel is known as vasculitis. Okay, so intima, media and adventitia. There are 3 layers. So here also you can see the 3 layers in the wall of the blood vessel. I want you to appreciate the intima. I want you to appreciate the thickest one, the media, and I want you to appreciate the externa or the adventitia. So if inflammation is occurring in any of them, the intima, the media and the externa, so most of the time the media is involved, it is known as vasculitis. So this is the definition of vasculitis. It is an inflammation of the wall of the blood vessel. Here you can see that is vasculitis. Now let me tell you the classification. As I told you, we will see the classification based on 2 bases. The first classification is based on the size of the blood vessel, and the second classification is based on the type of inflammation. So let me tell you the first classification. We divide the blood vessel into 3 categories. There are certain large blood vessels, certain medium blood vessels and certain small blood vessels. So vasculitis are of 3 types. The vasculitis involving large blood vessel is large blood vessel vasculitis, medium blood vessel vasculitis and small blood vessel vasculitis respectively. In the large vessel vasculitis, we have only 2 diseases here. Both of them are TT. You can learn the mnemonic TT, temporal arthritis and Takayasu arthritis. TT. Temporal arthritis and Takayasu arthritis, you can learn. In the medium vessel also, we have 3 diseases. The mnemonic is PKB. You can learn PKB. Polyarthritis nodosa, Kawasaki disease, Berger disease. Polyarthritis nodosa, Kawasaki disease, Berger disease. So that is the medium vessel vasculitis. And in the small vessel, we divide them in 2 categories. ANCA positive, ANCA negative. What do you mean by ANCA? I will explain. What is ANCA? The full form of ANCA is anti-neutrophilic cytoplasmic antibodies. I will explain what you mean by ANCA. First learn the classification, then I will give you the details of ANCA. What is ANCA positive, ANCA negative? So ANCA positive are further of 2 types, P ANCA or C ANCA. I will explain you the 2 types of ANCA. P ANCA, there are 2 vasculitis which are P ANCA positive. Microscopic polyangiitis, which is a variant of classical polyarthritis nodosa, that is classical PAN. It is a variant of PAN only, the microscopic PAN. And the second is the Churg-Strauss vasculitis. And C ANCA is only one, that is Regner granulomatosis. So first we will learn the classification. Based on the size of the blood vessel, we divide the vasculitis into 3 categories. What are the 3 categories? The 3 categories are large vessel,